Hello, I'm Brian Gustin, President of the American Orthotic and Prosthetic Association. This year, AOPA has been representing the interests of the orthotics and prosthetics field, as well as the patients we serve during the current congressional deliberations relating to healthcare reform. AOPA members have been active in lobbying during our April Public Policy Forum, as well as many other times throughout the year. Over this period of time, AOPA has developed a very strong working relationship with the Amputee Coalition of America. So many have contributed to this effort that it is impossible to acknowledge everyone. However, I would like to specifically mention AOPA's Executive Director, Tom Feiss, who has coordinated many AOPA events. We also need to recognize key players of the AOPA lobbying team, including Tom Scully and Stephanie Keenan from Alston and Byrd, as well as Nick Littlefield from Foley Hoag. We should also recognize Peter Thomas, counsel to the O&P Alliance, for his hard work. Board member Rick Fleetwood and former board member Tom Kirk have devoted substantial time and energy, and many have gone beyond the call of duty in their commitments to the O&P PAC. Finally, Kendra Calhoun and Morgan Sheets of the ACA have been excellent partners in these efforts. Together, we have created a vibrant program. Earlier this week, in conjunction with an assembly of ACA members who visited the Hill in an event co-sponsored by AOPA, we had the opportunity to speak face-to-face with several key members of Congress. The purpose of this video is to take you inside congressional offices for some of these conversations. This will provide an update on thinking and options about the latest directions in healthcare reform and how this touches on O&P, your future, your reimbursements, and your patients.
So, Congressman, it seems that some form of health reform is inevitably going to pass, but a lot of amputees are concerned that the quality of health care may diminish. Specifically, I'm more concerned about kids for my foundation. How can we ensure that they have the best prosthetics they can afford to live happy and productive lives?
I think this is critical that you've brought this issue to the Congress, because there's a lot of big issues that are being talked about with health care reform. There's not a lot of people that are talking about this issue, especially as it relates to children. And some of the things that we're doing in the bill that will help address this issue deal with the issue of lifetime caps and annual caps, pre-existing condition exclusions, things that the private insurers do today that prevent children from getting the coverage that they need, especially through the years as they get older. And some of the things that we've talked about today dealing with the cost of children who are growing and have to replace their prosthetics over time. These are things that are completely out of pocket once you hit that cap. And under this bill, there won't be a lifetime cap. There won't be an annual cap. So these are circumstances that there would be coverage all the way through, which is going to spare the families of those children and the children themselves as they continue to grow all the expensive treatments and out-of-pocket costs that go with it.
The pre-existing condition, eliminating that, and eliminating the caps, lifetime caps and annual caps, is a very meat and potatoes of this legislation. And not only are they important in the initial House legislation, but I am absolutely confident that they will be contained in the final version, which we ultimately vote on and pass. No matter which version is taken up, those two issues are front and center.
One of the things that you've done has been the leader on our Medicare Orthotics and Prosthetics Improvements Act. And while we're not going to convert you because you've already been converted, I'd just like to ask you for your thoughts on kind of how that stands, this small little issue that will save a modest amount of money in the big healthcare reform picture.
Well, hope springs eternal, and I'm hopeful that we'll be able to include it in the final version. What we actually need to do is get CMS to actually enforce the laws that we've already passed and their own rules and regulations. Now, one would think that shouldn't be that difficult, and it's almost incomprehensible to me that Congress has to pass another law to get the regulating agency to enforce the law that we've already passed. But that being the case, I guess we have to do that, and we will.
Senator Corker, the Amputee Coalition of America represents the 2 million Americans with limb loss in the United States. And we're hearing a lot that if this health care reform does pass, that a lot of people are concerned that their limb care will be negatively affected. What do you say to their concerns?
Well, I'd say, first of all, there is no bill right now. And being here, like you are right now in the height of the debate, is very important, because what happens is you come here, we realize there's an issue there that needs to be addressed, and I just want to say that it's seeing a face and a person who's been affected in this way. Those are the things that really affect us as we sit down and go through legislation. So you're right to be concerned. I mean, if we end up with, say, a one-size-fits-all type policy, then obviously people who have extreme issues to deal with could be adversely affected. One of the issues that concerns me is just the whole innovation. My guess is that you've been very positively affected by innovations that have really caused you to have more mobility than you might otherwise have had. So we need to, as we move through this healthcare debate, we need to preserve our ability to have the very best technologies available to people. At the same time, figure out ways of controlling cost.
People are very concerned about the prospects that this is going to be funded by cuts to providers, to the physicians and to the orthotic and prosthetic providers who provide the care. What do you see as the limits on this? Is this going to happen? How much do we have to worry about it?
Well, it's hard to gauge people's motives, but I think a lot of people that would support the government option, the public option, are looking for ways to pay for a new setup like this. And where they will go is health insurance companies, because the perception is that they've been taking advantage of people for a long period of time. And I said earlier, I'd like to see them held more accountable myself. And then, frankly, the provider system. But the provider system with medical professionals has already been squeezed pretty tight. And there's nowhere to turn, frankly. And what happens if you squeeze those benefits from providers, they will just opt out. They simply will just not cover that group of patients. And that creates an even bigger pressure on the system. So I think we need to actually, as lawmakers, kind of refer to the Hippocratic Oath, above all else, do no harm. Because if we create a system that creates more problems than the ones we're trying to solve, we've made a mistake. And that's one of the problems with rationing benefits in Medicare. There are a lot of doctors right now that, frankly, are just going to opt out of covering Medicare patients. And if we have a one-size-fits-all new standard where basically all health care prices are going to be reimbursed at Medicare rates, there's a lot of providers that can't make a profit. They can't make a living. Their medical liability insurance is too high. You know, their cost of doing business is too high. The economy is weak. So this burden is going to have to be paid for somewhere. And I don't think it can all be absorbed of the new cost of national health care by the systems that we currently have in place, whether it's health insurance or the current providers of Medicare and Medicaid benefits.
A key issue that folks in the amputee community are concerned about is the issue of parity. The Amputee Coalition has had great success in having 17 different state legislatures adopt a parity bill. But now we're working on a federal parity bill. It's been introduced in the House, and you probably are